Thank you very much, and I'm pleased to have this opportunity to speak to you. Talked about my business ownership. I'll tell you about a couple of the businesses that I own. I've got the best arrangement in the world. I own businesses with my children, and they run them, and I help them spend the money. So that works out real well. But one of my businesses that everybody says is very appropriate for somebody in politics is a roll-off trash business. You know, they say that's very appropriate for somebody in politics, but the other one they say is even more appropriate, and that's the portable toilet business. But I like to tell people, when you come to the University of Georgia and you use a porta potty on campus, I want to thank you for your business. So, but I do think that the fact that I did work for Shell Chemical Company, division of Shell Oil, for 18 years, and since that time when I left Shell, they sold our division to DuPont. DuPont wanted me to move to Iowa, and I said that wasn't even an option. I've been in business for myself, and I think that gives me insight into the issues that we all face as participants in the free enterprise system, which I think is the greatest system in America. Well, it's the greatest system in the world. You know, we don't have a health care crisis in America today. We have a health insurance crisis. And because we have the best health care in the world, it's often said that the rich Saudi princes come to the United States for their health care when they have some particularly complicated procedure that needs to be done. And so what the Affordable Care Act is trying to accomplish is to try to address the health insurance crisis in America today. You know, there's only a small segment of Georgia's society or population that's going to be affected immediately by this change that the Affordable Care Act brings on. Because how many of you are familiar with what an ERISA program is? It's under the federal leadership or federal control. It's the Employment Retirement Income Security Act. These are the large companies, and they're getting to be smaller and smaller, that want to have ERISA programs that are self-funded insurance methods that the employer is actually the one that is providing the health insurance for their employees. They often employ the services of a third-party administrator. And when you think of the large corporations that operate in Georgia, just about all of those are ERISA programs, which means they're self-funded insurance programs. Then you have the large group, which is 50 or more employees that the company provides insurance. Then you have small groups insurance. Then you have individual policies for people. Then you have a segment of society that's covered under Medicare. And then you have those making less than 100% of the federal poverty level that are covered by Medicaid. And then the rest of the population, they're uninsured. And that's what the Affordable Care Act is targeting, that uninsured population. And figures in Georgia say that could be as much as 1.8 million folks in that category. Of the insured, the people that have health insurance in Georgia, 75% of those are in ERISA programs. And that means that we and the State Department of Insurance have no control or really, that they're totally out from under our regulation. The other that are insured, we regulate, we oversee what they're doing. Now, the options that were given to us by the Affordable Care Act was first to establish the Essential Health Benefit Package. And this is 10 categories that every policy after January 1st, 2014 that is outside of the ERISA plans. Now, the ERISA programs do not have to conform to the essential health benefit package, but every policy that is outside of the ERISA programs has to comply in these 10 categories. Georgia has 45 mandates that they put on insurance companies that they have to cover this, they have to cover that, the things they have to cover, and they all fall within 8 of these categories that the essential health benefit package. The 2 that Georgia does not mandate that will have to be picked up in all policies after January 1st, the first is children's vision and dental. Every policy is going to have to provide vision and dental coverage for children. The other category is what they call habilitative services. Now, I had a hard time with that for a while. I didn't understand what habilitative meant. I knew what rehabilitation was. That's, you know, if you've been operating at this level and something happens to you, it knocks your performance to here. To be rehabilitated is to take you back to that level. But what was habilitative services? And I found out that primarily it's like speech therapy. A child is performing at this level in their verbal communications, and the average child is performing here. Habilitative services would bring that child up to what normal performance levels would be. So that was one of the things that all policies are going to have now. All policies outside of ERISA programs are going to have to conform to these essential health benefits. The next option that was given to the states was whether or not to expand Medicaid. The Affordable Care Act originally said that all states were going to have to expand their Medicaid population from 100% of the poverty level to 133% of the poverty level, and if they did not expand their Medicaid population, or the Medicaid population to 133% of the federal poverty level, then all Medicaid funding from the federal government to the state was going to be cut off. Well, the Supreme Court says that you cannot do that. That's basically blackmail. It was too high of a cost on the states, so they made that optional on the states. And so the governor and then the director of Department of Community Health, David Cook, who no longer is in that position, but the governor and Mr. Cook got together and they said that they are not going to expand Medicaid in the state of Georgia. And that was a state-by-state decision of whether or not to expand it. And our governor said no, because the cost would be too great on the citizens of the state of Georgia, because taxes would have to be raised dramatically to cover that. And Carl Rogers is sitting over here on the front row. Carl, you don't think you'd want to raise taxes in the state of Georgia, do you? Not today, okay. I didn't think so. I thought you wanted to be reelected. So they made that decision not to expand Medicaid. Now, the third option that the state of Georgia had was whether or not to establish an exchange. And Mr. Sanders, who was here, I think he may have left, explained somewhat what an exchange is. You call them exchanges, you call them marketplace. Now the idea for an exchange, I think is a very good idea. This is an idea that came down from the Heritage Foundation in Washington, which was one of the think tanks in Washington. In fact, it's one of the most conservative think tanks in Washington. And an exchange was meant to be a place that an individual could go to this exchange, and the exchange person, and the bill calls them a navigator, the exchange navigator could explain to that individual ask some questions to determine what their needs are, and then guide them to, or tell them, explain to them what their options are regarding the products that are available in that exchange and what may fit their needs best. Now, they cannot be compensated by the insurance companies on the exchange. There's no commissions. They have to be an employee of the exchange, and that they just the navigator is an employee of the exchange. Georgia decided through the Chairman Richard Smith, who is chairman of the House Insurance Committee, and John Meadows, who's chairman of the Rules Committee, came up with not an idea. They felt that it is imperative upon the citizens of Georgia to be protected. And so they introduced House Bill 198, which is, or it is now law, and the governor has signed it. It said that in order to be a navigator in the state of Georgia, that you have to be, you have to take a test and pass that test, and that's a test that we have designed that they have to pass. They have to take the 25 hours of federal training in order to qualify to be a navigator, and they have to take an additional 10 hours of training that's designed specifically to help to have the navigator be able to comply with Georgia law, Georgia Medicaid laws, peach care, all of the various options that's available for a person. One of my jobs, and you were told that I'm actually commissioner of, that's not three, that's three. Commissioner of Fire Safety, Insurance, and Industrial Loan. But in all three of those positions, my job is to protect the consumer in the state of Georgia. And so I was a strong advocate of this navigator licensing bill. We've only had 7 people take the test to become a navigator. 7. Now, in Georgia, we have 34,500 health insurance agents. I see some sitting down here. Now, I fail to see how these exchanges can be up and operational October 1st, which is, 2 weeks from now, approximately. How they can begin taking enrollment when you have no more than 7 people that have been licensed to basically take the place of 34,500 agents. Now, everybody's not going to be coming into an exchange. The exchanges supposedly are to become operational October 1st, with all these products that are being sold on the exchanges to go live January 1st, 2014. As Mr. Sanders says, we have 5 different companies, and he named them. They're Blue Cross Blue Shield, Humana, Kaiser, Peach State, and Alliant Healthcare that have offered products on the Georgia exchange. That's going to be a federally facilitated exchange. It's not going to be a state-based exchange. The options were states could either do a state-based exchange, you could have a federally facilitated exchange, or you could have a federal-state partnership exchange. We had 18 states said they were going to do a state-based exchange. 7 states said they're going to do a federal-state partnership exchange. And then you had 26 states say that they were not, states and jurisdictions of Washington, D.C. is included in this, said that they are not going to establish a state-based exchange. They're going to let the federal government do it. And so the federal government has this responsibility to establish this exchange. They have awarded 2 contracts to 2 different entities. One of them is the University of Georgia Extension Service, which they have basically an office in every every county in Georgia. They may not have a county agent in that office, but they have an office there. And then the other group that's been awarded a navigator contract is SEEDCO, which is a coalition of nonprofit organizations that have come in, and I don't know what I'm sure it's an acronym. If it's not, it sounds like a corn seed company. But SEEDCO and the UGA are the two entities that have received grants from the federal government to be navigators in the state-based exchange, or the federally facilitated exchange here in Georgia. Now, there's an interesting thing that's going to happen on January 1st. The last information that I was told by the Attorney General, there are several states that are going to go together and file an action against this Affordable Care Act. And the reason they're going to do that, a very, very strict reading of the law, if you read it and you read it very, very strictly, it says that subsidies are only available to individuals that purchase insurance through a state-based exchange. Now, that's going to mean that the exchanges in Georgia, that there's going to be no subsidies available to people that are under 400% of the federal poverty level. When I was at a meeting and Secretary of Health and Human Services, Kathleen Sebelius, was there, and she was asked about this. And when she was asked, she kind of looked up and said, well, that's not really what they meant. What they really meant was that any government-established exchange, whether it be federal government or state government, well, that's not what the law says. And I think that according to I think Oklahoma has taken the lead on this, that they are filing a suit against the federal government saying that no subsidy, no taxpayer subsidy money is to go to any citizen of a state where it is a federally facilitated exchange. And I don't know whether this is going to maybe stop the Affordable Care Act or not. I know that there are many efforts in Congress to defund, as they were talking about earlier, to defund any participation in Obamacare or not, or Affordable Care Act. But the subsidies, and I'm a little perplexed here. I'm going to try not to be political, but I'm a little perplexed in the fact that I was in the legislature for 14 years. I was 6 years in the state house, and then I was 8 years in the state senate, and the last 6 of that I was chairman of the Senate Insurance Committee. But in those 14 years, every time we passed a law, and I think that Representative Rogers will agree with me, every time we passed a law and we gave it to a state agency to implement it, then we expected them to implement all of it, not decide, well, I like this part and I don't like that part, so I'm going to implement this part, I'm not going to implement that part. But that's what's happening in the federal government. The mandate for large employers, specifically in the law, says it has to start January 1st, 2014. That's been kicked back a year. Other things, the qualification for a subsidy in the exchanges, in state-based exchanges, was specifically said that the IRS, and they're the watchdogs in this, the IRS is to determine through previous income what their income is, so therefore how much subsidy they get. But now they say, well, we're not going to do that. We're just going to let people self-verify and tell how much their income is. Well, let me tell you, I told you I was in the state house for couple of terms, I represented part of Hall County. I represented the Gillsville precinct. And I remember specifically, and Carl was probably there, we had a meeting with all of the various state agencies in Hall County with the legislative delegation. And Representative James Mills at that time was in the House. And I remember James Mills asking the lady representing the county health department, said, let me ask you, says, how many illegal aliens do you give services to? And she said, oh, none. We don't give any services to any illegal aliens. James then said, well, how do you know for sure that they're citizens of the United States? She said, well, we ask them. And that's the same thing that's going to happen in these subsidies for this, in the exchange. They're going to ask them how much money they make, and the less they make, the more their subsidy. If you make anywhere from 100 to 100 and, I've got the figures here, I can't remember, 100 to 133% of the federal poverty level, you're only going to have to pay 2% of your total income for your health insurance. Now, the cost of the product is going to be the same, but you're only having to use 2% of your gross income to pay for health insurance. The government's going to pay the insurance companies the rest of it. If you make anywhere from 300 to 400%, the maximum you're going to have to pay is 9.5% of your gross income for health insurance. So it's a varying scale. So the less you tell them you make, the less you're going to have to pay for your health insurance, although it's going to be the same exact health insurance that you get. If you're getting a bronze or a silver or a gold or even a platinum plan, you're going to pay the same, you're going to pay less the less money you make. And so this concerns me. What's going to happen to the cost? The cost of products are going to go up tremendously. If you make more than $45,000 as an individual or more than $94,500 as a family of four, your premiums, you're going to get no subsidy and your premiums are going to go up. And you say, well, why are they going up so much? Well, number one, it's mandated now that pre-existing conditions have to be included. And so I've had insurance companies come in and tell me that just that one factor is going to double the cost of insurance, that they have to cover pre-existing conditions. The second factor is age band. Currently in Georgia, we have a variation as much as 7-to-1. The young invincibles, as they were talking about, often pay 1/7 of the elderly population for health insurance. In this new, according to the Affordable Care Act, this variation can only be 3-to-1. So they're not going to reduce the elderly's cost. They're increasing the young folks. The young invincibles are going to see the largest increase in their insurance. The guaranteed issue. When you sign up and you apply for insurance, it's got to be given to you. And so I know there's only going to be open enrollment periods at certain times, but if somebody is sick, if they don't have insurance and they can just hold on to the next open enrollment period, then they can get insurance. They can get it, and all their health care costs are going to be covered. So these things are all playing together. No more can they separately rate a male and a female. They're all rated the same. There's only 3 factors that can affect your premium that you're going to be paying for health insurance. One of them is where you live, because it's cheaper for cheaper for medical services in the Atlanta area than it is, say, down in southwest Georgia, where you only primarily have one one provider of health care, and that's Phoebe Putney Hospital. So if you live in Southwest Georgia, it's going to cost you more for your insurance than if you live in Atlanta. The second factor is whether or not you smoke. They can charge you more for if you smoke or not. And then the third factor is your age. They can charge the elderly folks more than they do for the younger, but it can only be 3 times more. Obviously, I'm running over time. The man's creeping up on. I look forward. He's got a hook in his hand. I don't understand. I look forward to your questions when we get to the panel.